Hi, my name is Dr. Julia Ward. I have a functional medicine practice in Houston, Texas, and I focus on holistic health, bioidentical hormone replacement, nutrient deficiencies, and I do some aesthetic work as well. A lot of patients come to me and saying, I'm just feeling fatigued all the time, I just don't feel as good as I used to, or I can't sleep. You know, the sleeping has really gotten bad. Stress is a big thing, but a lot of it's fatigue. Like, it's so hard to get through the day. I need my coffee, and then I just feel mentally sluggish, like I just can't think. So I do a lot of the basic labs to make sure that it's not something really obvious like anemia or thyroid that's not working properly. But I will also look for balancing the hormones. I look for nutritional deficiencies and some genetic markers too that may play into their chronic fatigue. So with the hormone therapy that I do, it's bioidentical. With any hormone therapy, you don't want to take estrogen or testosterone in a pill form. They can cause a whole bunch of bad side effects, including increased blood pressure, increased triglycerides, carbohydrate cravings, and liver inflammation, just to name a few. So because of that, we want to either do a transdermal route, which is a cream that you put on twice a day, or we can put a pellet that goes under the skin. The idea behind hormone replacement is to maintain those youthful levels of hormones for the rest of your life. And of course, there's other health benefits: prevention of memory loss, prevention of bone loss, and cardiovascularly, it's very protective. I also look a lot at gut health. People don't realize that their immune system is intimately tied with the gut, as well as brain function, their mood, their energy that way. So we really have to make sure that people are eating a good diet, and that they're digesting well, and that they're detoxifying well. And all this is related to the gut. So I do recommend a lot of people to take gluten out, at least for a while, because that will cause a leaky gut. A lot of people come to me and they're on proton pump inhibitors, and that really destroys the pH of the stomach. They don't break down their foods well. They get a bacterial overgrowth in the small intestine, and there's just all kinds of problems related to that. So it's very hard actually to get people off those proton pump inhibitors, especially if they've been on it for more than a year or more. And frequently I see people on it who've been on 5, 10, 20 years. I do use a lot of probiotics. I like to rotate probiotics. We don't want to just use the same one for a year. You want to rotate it every 3 to 4 months. There's a lot of vitamin companies that I use that produce pharmaceutical grade vitamins. So I always tell people there is a difference. You can't just go to your local grocery store and buy some of these things. Inflammation is one of those prevalent conditions in the body that people don't even know that they have inflammation, yet it's going on. If anyone is overweight, if their cholesterol is elevated, these are all signs of inflammation. So we want to get to the root cause of why is it inflamed? How can we improve that? How can we get the inflammation to come down? And we do that via lifestyle changes and some supplements, fish oils. There's some new products out on the market that really are focusing on that anti-inflammatory process that would help as well. I tend to put most of my patients on a mild detoxification initially while we're waiting for blood results and urine and saliva tests to come back. And this is sort of a modified elimination diet in conjunction with some, plant-based protein powders that kind of really help detox the liver, support those phase 1, phase 2 reactions going on in the liver. And people generally will lose weight on this. They will feel better after doing this. And it's not a long thing. It's not a starvation detox. It's generally a week to 2 weeks on this program. Part of my practice is doing some aesthetic work. I do the injectables like Botox, Dysport, and the fillers. We'll also do microneedling, which is a great way to kind of rejuvenate the skin surface. It's poking a bunch of holes in the skin at a high rate of speed, and this stimulates growth, repair, collagen formation with very little downtime. We can also add platelet-rich plasma to that, where we take your blood, spin it down, and we get the plasma, which is the golden fluid that the blood floats in. It's full of growth factors, and we put that on the face immediately before and immediately after the microneedling, and that really accelerates all that growth and repair and collagen formation as well. So if you would like more information about my practice, or if you would like to schedule a consultation, please visit my website, juliawardmd.com.